What is the history of LGBTQ plus healthcare advocacy? Imagine a world where everyone can see a doctor who truly understands and respects who they are. That's what LGBTQ plus healthcare advocacy has been working toward for decades. It all started in the early 1970s when activists began pushing for better recognition and treatment. In 1973, the National Lesbian, Gay, and Bisexual Task Force was founded. One of their first wins was convincing the American Psychiatric Association to remove homosexuality from its list of mental disorders. This was a big step because it helped reduce stigma and changed how healthcare providers viewed LGBTQ plus people. During the 1970s and 80s, the HIV and AIDS crisis hit hard. It mainly affected gay men and other queer communities, exposing how neglected and discriminated against they were in healthcare. Activists fought for more research, federal funding, and fair treatment. Groups like the AIDS Action Council started pushing for faster drug approvals and better care. Activists wanted doctors and hospitals to be more informed and welcoming, not dismissive or hostile. Transgender healthcare advocacy has its own long history. It began in 1919 with Magnus Hirschfeld in Germany, who worked on gender-affirming care. In the United States, the Johns Hopkins Gender Clinic opened in 1966. It was among the first to offer gender-affirming surgeries and counseling. But early practices often involved strict rules that made it hard for many trans people to access care. Over time, advocacy has pushed for more inclusive approaches that respect each person's identity and needs. As the years went by, advocacy expanded to fight discrimination in workplaces, support healthcare workers, and develop guidelines for culturally competent care. Advances like highly active antiretroviral therapy in the mid-1990s and pre-exposure prophylaxis in 2012 came from activism demanding better research and access. Today, the focus is on finding providers who are affirming, preparing for doctor visits by communicating needs clearly, and pushing for policies that make healthcare safe and respectful for everyone. This history shows how activism has transformed healthcare from a space of judgment to one of understanding and support for LGBTQ plus health and wellness.